Well, good afternoon, everybody, and again, I thank everyone for being here. The David M. Davis team that was here for the Dr. Flanagan visiting professor, and then for the others who arrived for this very important day in the history of Jefferson urology. We're very pleased here today to be honoring Dr. Scott Hubosky as the first recipient of the Demetrius H. Bagley Jr. Professorship in Urology. This has been a long time in the making. Dr. Bagley's career goes back 40 or 50 years, so this is, although the fundraising has only been going on for a couple of years, the foundation for this was laid many, many years ago. You all should have a copy of the formal program in front of you. We'll have some opening comments, a little bit on Dr. Bagley's life and career, and then we'll move on to the actual presentation of the ceremonial proclamation to Dr. Hubosky. But what I'd like to do first is just take a minute to acknowledge some of our esteemed guests who are here with us today. First, Jackie Bagley, Demetrius' wife, is here. Thank you, Jackie. Also, Jock and Kathy Bagley, all the way from the West Coast, are here to be with us. Dr. Bagley's son and daughter-in-law. And we have Dr. Elizabeth Dale, who will be making some opening comments, who's the Senior Vice President, Chief Development and Alumni Relations Officer. So Elizabeth will be up right here on the stage in a moment. We also have our Dean and Provost, Dr. Mark Tykocinski, who will be giving some honorary statements and comments on behalf of Dr. Bagley. We're also very pleased to have Dr. and Mrs. Robert Weiss here. Dr. Weiss is currently the Donald Guthrie Professor of Urology and the Emeritus Chief of Urology at Yale University. He was sort of a little bit of a hook that we pulled in because Dr. Weiss knows Dr. Bagley better than anybody since they trained together many years ago, and we thought it would be most appropriate for Dr. Weiss to be here to make some comments. So we thank also Charlie Wilhelm and Connie Patton, who are here, who helped us with this. Charlie and Connie are down there. Thank you all who helped us with the professorship. And of course, Amy Hubosky, Scott's wife, is here in the front joining us as well. And lastly, we have another very special guest here, Mr. Ken Pina, who has been a patient very long term of both Dr. Bagley and Dr. Hubosky. So Ken, thank you for being here today to share this. So without much further ado, it's my pleasure to introduce Dr. Elizabeth Dale to the podium.
Good morning. Thank you. Thank you so much for the great honor to be with you this morning. And I am truly delighted to welcome you today as a member of the Jefferson community as we honor the outstanding contributions and pioneering advances of Dr. Demetrius Bagley, a world-renowned innovator and educator in the field of urology. We also recognize the skill, the accomplishment, and the compassion of an outstanding Jefferson physician, Dr. Scott Hubosky, the first Demetrius H. Bagley Jr., MD, Professor of Urology. And we'd like to thank you for taking the time to join us in celebrating the distinction of our honorees and also acknowledging the generosity of benefactors who make professorships and days like this possible. Professorships are among the highest honors that faculty receive, an acknowledgement of the esteem with which the institution holds them. And professorships provide a source of funding that enables our physician scientists to take on projects and make them stand out among peers, and make Jefferson stand out too. They also send a signal that the excellence of Jefferson in all of its dimensions is well worth the investment of time, talent, and treasure. The Bagley Professorship was endowed by numerous supporters, several of them medical manufacturers who collaborated with Dr. Bagley on instrument designs that advanced the field and helped to heal patients with urology disorders, thus cementing Dr. Bagley's reputation as a legend. Chief among our benefactors is Mark Chim, Chairman of Convergent Laser Technologies, and our major contributors also include John Abley, Peter Nichols, Richard All, as well as a major benefactor who is with us today who wishes to remain anonymous, and several other contributors. As an academically based health center, we can drive new ideas and convert them into products, strategies, and ventures that help patients and consumers, much as Dr. Bagley has done. We are truly grateful to the benefactors whose contributions to honor Dr. Bagley make more discovery, further learning, and greater healing possible at Jefferson. Congratulations to Dr. Bagley and Dr. Hubosky. Thank you.
Thank you, Elizabeth, for those very nice comments. And now it's my great pleasure, from pulling him away from graduation and many meetings, Dr. Mark Tykocinski, who is our Provost and Executive Vice President for Academic Affairs in the Anthony F. and Gertrude M. De Palma Dean of Sydney Medical College. It used to be easy to say he was the Dean at Jefferson, but he's gotten so many new titles, and we have a new medical school name, I have to read it off the card. So, Dr. Tykocinski,
thank you. It's really an honor to be here for this incredible occasion. This is just a great time of year. It's really fun. Because I just went through 2 days of 3 different graduation ceremonies. Yesterday was the medical college one. So we were celebrating students. Today we celebrate one of our great, iconic faculty members, Demetrius Bagley. I do want to welcome here Dr. Davis from Loyola and Dr. Weiss from Yale, my undergraduate alma mater, so I feel particularly connected. Always looking for an angle to get Yale and Jefferson together, so this is really good. I'm going to read my comments. Dr. Demetrius Bagley has been at Thomas Jefferson University since 1983. At that time, he came from the University of Chicago. This followed his education with undergraduate and medical degrees at Johns Hopkins. He then completed 2 years of general surgery and residency at Yale New Haven Hospital, and before entering a 3-year fellowship in oncology at the surgery branch of the National Cancer Institute. This is sort of funny because I spent the morning, we're rethinking medical education. We're starting this initiative together with Stanford to rethink medical education in this country. We're calling it Beyond Flexner. The whole goal is shortening the continuum of medical education. And I'm reading Dr. Bagley's background, and this is sort of at the other end of the spectrum. His first faculty position was at the, he went back to Yale for his 4-year urology residency. His first faculty appointment in urology was at the University of Chicago, where he progressed from assistant professor to associate professor between 1979 and 1983. And it was in 1983 that he came here to what we then called ourselves Jefferson Medical College, where he now is the Nathan Lewis Hatfield Professor of Urology and Professor of Radiology. It was in Chicago that Dr. Bagley gained his major interest and expertise in urologic endoscopy, laser therapy, and the treatment of calculi and intrarenal neoplasms. He worked with Ed Lyon and Jeffrey Huffman, and together they developed the early techniques and instruments as the basis for ureteroscopic diagnosis and treatment in the upper tract. The Department of Urology at the time of his arrival, consisted of Dr. Grant Mulholland and Dr. Bagley, and volunteer faculty including Dr. Ken Brownstein, who's here today, with 2 residents each year for 4 years. With the small size of the department at that time, Dr. Bagley filled other functions. He was the urology member at the Sexual Function Center. He performed vasostomies with resultant pregnancies and many large open surgical procedures. Philadelphia, like most of the world, had essentially no minimally invasive urology at the time. Dr. Bagley's first case in Philadelphia was the percutaneous treatment of a renal calculus. In collaboration with the CVIR radiologist, they completed it successfully with early discharge of the patient. Dr. Bagley's efforts as an educator are known nationally and internationally. He's lectured in over 35 countries and has operated in many. He expanded the effect of these efforts by including students, residents, and nurses from Jefferson, notably with foreign trips including Egypt, Brazil, France, and Saudi Arabia. He ran a series of holmium laser courses with demonstrations and hands-on experience at the AUA and throughout the world. The major series was in collaboration with Dr. Akhil Das. Together they covered applications throughout the urinary tract. Locally, he established the Urology Symposium in Avalon. This is an annual one-day symposium first started 16 years ago. It was conceived as an informal off-site meeting directed at residents, but also included non-physicians and has grown as a non-cost CME event for all urologists. He has also established a non-physicians journal club for Journal Club. These combined efforts won him a Jefferson Award for interprofessional education in 2012. The Department of Urology has offered a fellowship in endourology under Dr. Bagley's direction since 1990. Publications, hold your seats, including over 350 papers and chapters, include the first major textbook, Urologic Endoscopy, a manual and atlas in full cover. He's also co-author of Ureteroscopy. You can tell I haven't trained in urology, so I'm stumbling on that one. The first book on ureteroscopy. More recently, he's co-editor with Dr. Michael Grasso, a former resident of the textbook Upper Urinary Tract Urothelial Carcinoma, which will be published in July of this year. So his productivity continues forward unabated. In collaboration with Dr. Allison Berendt, a veterinarian, he introduced the benefits of urologic endoscopy to animal patients, and this I found incredibly interesting. Together, they've treated stones, bleeding sites, and tumors in many different animals. They have ureteroscoped a horse, dolphin, and lion. The latter here in the Philadelphia Zoo was the first time unilateral hematuria was treated endoscopically in a lion. They also treated a renal calculus in a snow leopard with shockwave lithotripsy. So anything to travel wide and far. I don't know if the snow leopard was here in town or was it up in where snow leopards live. Okay, I should have thought of that in my career. Read slides. And, Dr. Bagley has been a major spokesman for the techniques and applications of minimally invasive urology, particularly ureteroscopy. In addition to his publications, he's carried the word throughout the U.S. and the world as visiting professor with lectures, demonstrations, and hands-on laboratories. Many urologists owe their initial experience and expertise to Dr. Bagley's teaching. Dr. Bagley has been cited in the Best Doctors of America and Philadelphia Magazine's Top Doctors for stone treatment, cancer treatment, and ureteroscopy. Dr. Bagley received the Endourology Society Lifetime Achievement Award in 2010. In 2012, he was the recipient of the Valentine Award from the New York Academy of Medicine. He is an internationally recognized expert in the field of endoscopy. For these accomplishments, the American Urologic Association presented Dr. Bagley with a Lifetime Achievement Award during the annual AUA meeting in Orlando in May 2014. In 2012, Drs. Gomella and Brownstein, working with the Office on Institutional Advancement, formed a committee to establish a professorship in Dr. Bagley's honor. Today, colleagues, friends, family, and supporters of Demetrius gather to see this become a reality, and it's my honor to have been able to be here to summarize really someone who has emerged as one of the giants of his field, and certainly one of the most distinguished faculty that we have been privileged to have here at Jefferson. As we've noted, Demetrius has been an outstanding medical educator, especially for the residents. For over 30 years, 32 to be exact, residents rotated on his service for 6 months during the 4-year experience. As he said to many of them, quote, "If you don't like me or I don't like you, we still have to work together for 6 months." One of these residents, I guess this one liked him, is Dr. Scott Hubosky, who served as a resident under Dr. Bagley from 2001 to 2005. Scott has gone on to continue the tradition of Dr. Bagley's excellence in research, teaching, and patient care. Today, we're pleased to also acknowledge the contributions of Dr. Scott Hubosky as the inaugural Demetrius H. Bagley Jr., MD, Associate Professor of Urology. The Jefferson community congratulates Dr. Bagley on this honor and thanks him for over 30 years of service to both us and to the larger community as well. Thank you.
Thank you for those very nice comments. Next, I'd like to invite up Dr. Bob Weiss, who's the Chairman Emeritus at Yale, who has some very close personal encounters with Dr. Bagley over the years. So we welcome Dr. Weiss, and he has a little bit of a head cold, so we hope that the microphone will project all the way to the other side of the conference room. Dr. Weiss.
Thank you. Dr. Gomella, knowing that Demetrius and I have been friends and colleagues for many years, has asked me to say a few words and provide insight into the real Demetrius Bagley, if that is possible. In the beginning, there were 2 kids parallel playing about 3 miles apart in Whitefield, New Hampshire, a small town in the White Mountains of northern New Hampshire. Demetrius's grandmother and family lived there, and my family vacationed there in the summers. Little did the boy from rural New Hampshire and the boy from urban New York City know that a long friendship was beginning based on similar interests and a mutual love of mountains. Demetrius went to Johns Hopkins for college and medical school, and I went to Franklin and Marshall College. 2 football powerhouses. We played each other. The similarities continue, as Hopkins is a national lacrosse powerhouse. Demetrius's son, Jock, played lacrosse and coaches lacrosse at UCLA, and Franklin and Marshall women are in the Final Four for lacrosse. Following medical school, Demetrius came to Yale as an intern and then first-year general surgery resident. When he rotated on urology, we both became aware of our mutual history in and mutual love of the White Mountains. In fact, Jackie and Demetrius first met my wife Ilana on the top of Cannon Mountain. As I recall at that time, his mentor was Tom Krissick, and Demetrius was headed for a career in plastic surgery. What a loss to urology that would have been. I'd like to think that I had at least a small part in bringing a true leader to urology. In any event, as Yogi Berra said, when you come to a fork in the road, take it. Demetrius took it and has become one of the outstanding leaders of urologists of our era. Following 3 years at the NIH, Demetrius returned to Yale as a resident in urology. I know I helped in supporting his application for the residency. Demetrius was an excellent resident. I know that he likes to say, if it can't be done with an endoscope, then maybe it should not be done. From experience, I can tell you that he was an outstanding open surgeon. His love for endoscopic surgery was not based on a lack of ability in the open procedures. His future productivity could be seen as a young resident. An example was that at that time, each resident rotated for 6 months on the private service. This was a sleepy rotation, and most of the residents complained that they spent hours doing scut work and with little surgical gain. Demetrius did not complain. He disappeared. He wrote papers and has never stopped, and his CV shows over 350 publications. I will tell you a little secret. As a junior resident, it was known that Demetrius was always late. When he became chief resident, he was threatened that if he were late, he would not get to do cases. What does a good friend do? I made morning rounds with the residents every day for 6 months at 6 a.m. in the morning. Demetrius was shamed into being on time. If you ask me to provide one word to characterize Demetrius, it would be innovative. As Oscar Wilde said, consistency is the last refuge of the unimaginative. As Robert Weiss says, today's dogma is tomorrow's dog shit. As Demetrius himself has said, I would try almost anything new because it was. Demetrius Bagley could look at what has been done in the past and astutely derive something new, innovative, and better. A typical example of this astute analysis occurred while we were fishing in a small lake in the White Mountains. The two of us had been fishing for at least 2 hours and had caught nothing. I said, Demetrius, this is boring. What do those who like fishing like? He replied, do you hear Jackie, his wife? I said, no. Do you hear Ilana, my wife? I said, no. He said, that's what they like. Shakespeare said,
I just want to say this has nothing to do with Jefferson.
Shakespeare said, all the world's a stage, and all the men and women merely players. They have their exits and their entrances, and one man in his time plays many parts. Demetrius Bagley's accomplishments have been many and diverse. His name is synonymous with ureteroscopy. He has ureteroscoped a lion with hematuria, a dolphin and a horse with stones, and has cystoscoped and performed SWOL on a snow leopard. He has urologic instruments named after him. He has been elected to the most prestigious urologic academic society, the GU Surgeons. He has received a Lifetime Achievement Award from the AUA. He has been the visiting professor at many leading institutions around the world, including Yale. Demetrius, when you were visiting professor at Yale, you brought numerous pictures of me drinking beer in the White Mountains. You are lucky. I called several times to see if I would have PowerPoint. I was told no. Otherwise, I would have gotten even. He is admired by his mentees, residents, and fellows, who he affectionately has referred to as dumb shits, and who have followed his career pathway. And perhaps the most important accomplishment that he had was being married to Jacqueline Hickey, which I believe is 45 years tomorrow, and sired Jacques Bagley. Many of you know that I spent 1 year of my life 800 miles from the North Pole. And there I learned the first law of the Arctic. It pertains to dog sleds. Only the lead dog has a changing view. To the rest, the view is rather monotonous. Demetrius, you have been a lead dog You have been a leader. Congratulations.
Videotaping this, but we'll make sure the Jefferson censors don't get their hands on it so it maintains the full flavor. Thank you, Dr. Weiss. Next up, the man of the hour, Dr. Bagley. Would you like to make a few comments? And if you have Dr. Weiss's beer slides, we can load them in for you. So.
Payback is hell. And then he blew the whole thing with pictures. I can't even talk about the pictures now. It's done. They were good pictures, though, if I can describe it. Holding beer. Could be glass. Could be a bottle. He could be in a tuxedo, three-piece suit, or could be in T-shirt on the island. Could be standing up like that, sitting there. It could be slumped over like that. Thank you. Thank you, Dr. Tykocinski. I certainly want to thank everybody who's made it possible. The donors, it's certainly not possible without our many donors and friends there. Kenny Brownstein, Molly Gerber were lead in asking for money. Nobody gives it unless you ask for it generally. They did, and friends came around and gave money. Among those in attendance, I want to thank the Weisses for being here. Barb Devine is here, assistant for 31 years, 2 years, somewhere in that range. I think probably her happiest day was when I learned to use email on the iPhone. Email came in paper a long time. Connie Patton and Charlie Wilhelm are here. They're old friends from the days before when I was at Jefferson. And the other OR, other friends here from the OR, from the office, from industry. Family, you mentioned my son Jacques and Kathy are here. Actually, they're in town for a rugby tournament. True? He was both. Jacques was very helpful to me. About 4 years ago, I needed some stem cells, and he donated some half-matched stem cells. They didn't like me for a while with a little graft versus host, but it worked. His biggest complaint about all that was not the pain, not the time, but he had to give up drinking for 2 whole weeks. He tells me about that. My wife, Jacqueline, as Bob mentioned, she put up with me for a long time. Fed me real food when I was actually in the hospital. And as you mentioned tomorrow, we've been married 45 years, which is a long time of putting up with me. You who worked with me in the OR and the offices, you know, just imagine 45 years of that. Now Scott, I've known Scott certainly from the time of his residency. He said he actually met me when he was a visiting student here a couple years earlier than that. Another one of the students, I don't remember. But his wife Amy is here. They had a wonderful wedding a few years ago, thank you for that. And he has one characteristic, that he works and he gets it done. As some of you know, I discussed with some of the nursing administration that they're the workers and they're the overhead. And Scott's a worker, gets it done and produces. Now, remember that the intention of this professorship is in endoscopy. So when you decide to start writing about sub-PSA kinetics and velocity, I'm going to ask the donors to suck the money back. One last comment I'll make, keeping it short as I can so we can go to lunch. I haven't been doing clinical practice for really about 4 years now. Kept planning to go back, but was delayed by one thing or another, and I've decided not to return. Love the OR, but it would involve going back to 833, which I consider risk to humanity. So thank you, everybody, for coming. Thank you for your comments. I thought that you were very kind, very gentle. Thank you.
So there's a proclamation here, and I'd like to read the proclamation. Whereas the Sidney Kimmel Medical College of Thomas Jefferson University recognizes the contributions of Dr. Demetrius Bagley to the field of urology, and specifically for his pioneering work in endourology. Whereas through the generosity of the friends and supporters of Dr. Demetrius Bagley, the Demetrius H. Bagley Jr. MD Professorship of Urology has been established. Whereas Dr. Scott G. Hubosky has shown clinical and academic leadership in the field of urology and specifically endourology, therefore, Sidney Kimmel Medical College of Thomas Jefferson University expresses its appreciation to Dr. Hubosky for his service to the university and extends congratulations to him as the first holder of the Demetrius H. Bagley Jr. MD Professorship in Urology. This proclamation is presented in Philadelphia, Pennsylvania, the 29th day of May 2015. Great.
Now, it's a great pleasure to introduce the first Demetrius Bagley Associate Professor of Urology, Dr. Scott Hubosky.
Thank you very much, Dr. Gomella. I look around this room and one word comes to mind, and it's just overwhelming. I see people here who have trained me, and I see people who I've trained, and all kinds of people in the middle, my peers, people from the OR, support staff, the office, people from industry, old friends, new friends, my family. Truly, truly overwhelming. But on a lighter note, I thought back a little bit about my relationship with Dr. Bagley, and a little bit of history is in order. So he started here, as we all know, in July of 1983, which would have put us right now at about the 32-year mark. 28 of those years were such that he was mired in the trenches doing the clinical work and putting up with us as residents, switching over about every 6 months. So if you do the math, he's easily got through 56 residents that he's trained, and are now out there taking care of patients and pushing his legacy and all of the tricks and important things that he's taught us. Not to mention about 15 fellows as well. So out of those 56, I believe I was number 39 somewhere in there. But it truly is an honor. I, just like every other former resident in this room, remember very well the first time I was instructed at a relatively loud level verbally. let's just call it yelled at in the operating room. And those 6 months that I spent, every resident remembers them, but those were very special to me. A lot happened in those 6 months, but I do remember the first time, I had an MR6. I was doing some semi-rigid ureteroscopy, and we were having a little bit of trouble getting into the ureteral orifice. And don't ask me why, but I took a wire, put it through the scope, put it through the ureteral orifice, and tried to track the scope up like that. And his exact words were, well, almost exact words were, "What the blankety blank are you doing that for? Where did you learn that?" I know you didn't learn that here, like, but about probably 10 octaves, a little louder. Went right through me like a shockwave lithotripsy wave, probably. But, you know, never did that again, and that was sort of the way it was. And I think everybody here who is a former resident remembers that even though he may have gotten his voice up at times or yelled at times, he always told you the right thing to do. He would always say very loudly, "Rotate the scope," and that's exactly what you needed to do. Or ask for that instrument, and he was exactly right. You know, but again, going back to those 6 months, we saw, you know, a lot of progress to the point where I remember one of, you know, the most, I thought, complicated patients was a lady with a neobladder and a complete duplication on one side and one ureter on the other, but all three moieties had upper tract tumor. So we would find the 3 neo-orifices have 3 wires coming out, and probably spent about 3 or 4 hours treating tumor in that lady, and kept her with her kidneys intact for quite a long time. I remember back in 2002, we used the prototype for what is now the Flex X. And I remember looking at this thing thinking, wow, 270 degrees, that's crazy. And now 12 years, you know, later, it's, you know, it's proven to be one of the designs that's a template for modern ureteroscopic use. We also flew to Cook's place in Indiana, and I was taken back by the amount of sophistication that goes into, you know, designing these instruments. And, you know, a lot of that had to do with Dr. Bagley's influence and input. So at the end of those 6 months, I got away with my wife to St. Lucia, and I love telling people this story. I thought, wow, 6 months of this training, I finally made it. And we're taking a break. It's in between Christmas and New Year's, and we're on the beach in St. Lucia, and we're sitting on the beachfront. Amy was with me. And we're sitting on a wooden deck that's about 100 foot by 100 foot, maybe about 2 feet off the ground. Of course, it's like made up of 2x4s, so there's little slats in between. And there was a couple who was recently, you know, married, and the poor bride lost her engagement ring between the slats of the wood, right heart in the middle of that deck. And I'm thinking to myself, this guy is going to have to commando crawl at least 50 feet under this deck with all the scorpions and spiders on the beach and try to get this ring at him, you know, and get it back. So one of the things that amazed me was there was somebody on staff at the hotel who was a St. Lucian native, must have been no more than 25, and he came out with a flexible endoscope and a grasper and some very rudimentary light source. And he came down, and I'm like in awe. I'm like just watching this. Do you remember this, babe? And the guy basically looks down, and on the first attempt, he doesn't get it. And I'm thinking to myself, there's no way he's going to do this, because he's by himself, you know? And we usually have somebody operating the instruments, and he reaches down the second time, and he pulls it up like a treasure, and he's a hero. And I thought to myself, I can never take myself that seriously because of what obviously So with that, you know, again, I'm quite humbled by this honor, and I have what I would consider, you know, the world's best mentor. It's an embarrassment of treasures to work here in this capacity, and I want to thank everybody from the dean to Dr. Gomella, to Dr. Bagley, to all of my coworkers, peers, residents, students, support staff, and all of our friends in industry. Thank you very kindly.
Thank you all for being here for this great event, we will next have our David M. Davis 1:15. For those of you who are staying for the David M. Davis, we'll reconvene at 1:15. But for now, if everyone can join us downstairs on the 4th floor of the Hamilton Terrace for lunch and reception. And the former and current residence photo is at 12:45 out on the patio. That's our normal tradition to capture all the current and former residents. So if you're there at 12:45, you'll be there in the picture. If you're not there, we don't do Photoshop. So thank you everybody for being here.